All right, people, welcome back to One Body. I'm Cruzy,
I'm Eden.
and today we're joined by Megan Hatcher, who
Woo.
I still have Megan Clack in my head and in my contacts.
To be fair, I'm Megan Clack in Sean, my husband's phone as well. So
Oh, yeah.
she will never die.
She will never die. Did you keep it
Mm.
as your middle name?
Yeah. Which I was sad to, my middle name is Diane and I was kind of sad to lose it. But I feel like, Clack is iconic. It just has so
Clack
many
is
good,
so good.
so many nickname opportunities.
Yeah.
Clack Attack, Clack-a-lack, and Click Clack. You know, gotta keep with it.
What was your middle school nickname?
All of the above.
All of them. Yeah.
I had a high school teacher who, like, when he was like going down the roster, my first name was listed as Click and then last name was Clack. I don't think he knew my first name.
Welcome. Today we're joined by Click Clack.
Yep.
She is a women's health PA, physician assistant. So she deals with women's obstetric. I can never say that word. Obstetric and gynecologic issues. Megan and I actually, I've kind of been like following you, or you're following me. I don't know. We both went to Clemson undergrad.
Go
and then go Tigers. We suck right now. So
yeah, yesterday was really rough.
I'm embarrassed. I'm really embarrassed. And then we both went to Emory for PA school together.
Yeah.
What?
We're just on the same
You're
wavelength.
kind of obsessed with each other. Oh my gosh.
Right?
Obsessed. Yeah. And now
Just
we
wanna
both
be
live
where
in
you are.
Now we're both in the west side of Atlanta.
Right. Yeah.
And we work at the same
At
hospital.
Piedmont. Yeah.
so-
We're just literally always in the same place.
Yeah. I don't know. What's your favorite coffee shop? This is going to be weird if it's the same.
Probably Rev Coffee.
Oh, I've never even heard of it.
Oops.
Okay.
All right. I feel like that was a disappointing answer. It's in Smyrna.
REV.
Yeah, it's really cool. They I don't know, they're fun. And wait, what did you think? What was my answer supposed to be? No, I'm devastated.
No, it was supposed to be Spiller Park. But let me tell you, if you've never been, I think it's the highest quality coffee I've had kind of anywhere. It's so good. But I went this morning
Oh no.
on a little date with Palmer. I gawked at the register. I got gawked. Isn't that like, so I order a nut milk latte, which usually I hate nut milk, but currently I'm doing this like anti-inflammatory diet thing to try to help with my gut. So I'm like, what's your nut milk? They say pecan. And I'm like,
That's a new one.
That's new. I just get like I think it was a 12-ounce latte, nothing in it besides the
Just like coffee and
espresso
milk. Yeah.
and the milk. $10.10.
No.
I'm like, did you put 2 on there?
Was it blessed by the Pope? Like
Literally.
You got
But I had to because I'm like, I can't be cheap. I can't like not order this now. So the people behind me would have been like laughing. So I bought it and I really enjoyed it, but I cannot be recommending a $10 latte. Okay, Megan, what got you interested in becoming a PA?
I feel like I always knew I wanted to go into healthcare, but I can't remember exactly how I was exposed to the idea of being a PA. I just feel like it was the perfect happy medium of kind of like having the autonomy that I like to have, you know, with my patients and building like really unique special relationships, but also having some flexibility to like be able to change specialties, kind of be able to like shape my schedule a little bit more. I feel like it kind of gave me a little bit better work-life balance, perhaps, although I think all the providers at our practice are just amazing at how they can balance all of the things. I can't remember how I first found out about it, but I just remember thinking like, this clicks, this just like fits perfectly.
This clacks.
This clacks.
This just click clacks.
Oh, that's good.
I feel like the docs at our practice are so wonderful, and I have such a low threshold to be like, you know what, let me go ask one of them, or like let me grab one of the docs, get a second set of eyes. It just gives me a lot more reassurance in my practice knowing that I have a whole team of people behind me.
Yes, exactly. All right, since this is a health and wellness and science podcast, we need to know what's one habit of health and wellness that you swear by.
I like thought about this a lot because I'm a fan. I listen to the podcast. I knew I was going to ask this. I studied. I thought about this. And not that I'm like any kind of like a health and wellness expert. Not that I do this perfectly, but I feel like in the exercise world, weight training, resistance training. I feel like it's something that I talk with people a whole lot about. Whatever like stage of life that you're in, there's so many benefits of it.
Yeah, I agree with that.
I feel intimidated by weight training. How did you know? Like, do you have a coach or a trainer, or did you just figure it out on your own?
That is such a good question. When I was younger in high school, I played sports, played lacrosse, and one of the assistant football coaches ended up being the head girls women's lacrosse coach. And he changed essentially nothing from his approach to coaching young men to then coaching young women. And so he put us in the weight room. And so we learned how to like deadlift and, power, like all of that form and heavy lifting. I like learned that technique when I was young. And so I feel like that gave me a little bit more confidence when I got older. So actually that was a very lucky thing for me to have. But I feel like there's lots of apps and things. I mean, like having a personal trainer is awesome, but I feel like there's also apps. One that my sister recommended to me a long time ago and is what I use now. It's an awesome app called Moves by Madeline. You use it?
Yes. Yeah, especially through like pre and postpartum.
Yes.
Because I think she had 3 kids back to back, at least 2. Yeah. I've heard really good things about Evlo, EVLO. I don't know if you've heard of that one. That's a girl, I'm like from afar kind of obsessed with her. Have a friend crush.
I love that. Yeah.
She's a doctorate in physical therapy. Cool. And she started this app, but it's live videos. So if you don't like the Moves by Madeline is like you click through it, right?
Right. Yeah.
This one, Evlo, is live. So just whichever one you prefer.
Yeah, you feel like you're doing it with someone as opposed to like doing it alone.
Yeah. Okay, well, I love that answer and I agree. What got you interested in women's health specifically?
I kind of fell into it, honestly. It's such a fun specialty because it's 2 specialties combined into one, right? Like GYN and OB, like they're so different. They have so many components to each of them that are so obviously intertwined, but like so different. There's a lot of hands-on things, which I think is fun. Like procedures are fun. Honestly, probably my favorite thing about it though is I just yap with women all day.
I love that. That's good. And I know we need more women's health providers, so I'm glad you're doing that.
100%.
Yeah. Okay, this is funny. What's the cringiest and potentially most inaccurate thing about women's health that you see on social media?
Ooh, I love this. I love this. I don't know if this is like social media or just, I don't know, from myths that we heard when we were in 6th grade or, an old boyfriend or partner said something to you that stuck with you. Vaginal odor or like scent. I think that so many times women come to me and they're like, does like my vagina smell sometimes a little bit? I heard it should smell like nothing or it should smell like water.
It should smell like pansies.
Right, it should smell like roses. And I think also probably some of this comes from like there's a whole aisle at the pharmacy, right? Of like, here's feminine wash and feminine wipes and feminine spray. And it's like, why is this peony scented? So this is something that we have to break down, where it's like this is a whole organ, right? That is open to the world. Like we're interacting with the outside environment. It's got to moisturize itself. It's got its natural discharge. We're fighting off infections. What we have sex with. You have your period through your vagina. Like it's got a lot going on. So like it's gonna have a little bit of a smell to it. It's gonna change at times. That is never gonna be scented like a rose, right? So if I could just like burn down that aisle at the pharmacy, that would be the best thing ever.
Yeah. And that's really bad for you, right? To be like douching and scenting and all of that.
Yeah, when people come to me, they're like, I'm having recurrent infections. Like, I'm getting BV all the time. I'm doing this. I'm like, what feminine wash are you using? They're like, oh, I got this one. I'm like, stop, throw that in the trash. Stop. That was a trick question. It's so mean of me. They're like, oh, I'm glad you asked. I'm like, stop it. It's terrible.
Wrong.
Shouldn't smell like a rose. Yeah.
Okay, that is so good.
I can already just tell you were made for this. Like, I feel very comfortable. I already feel like more confident about my body. Like, genuinely, you have a really awesome, like, your personality, the way you talk is probably really helpful.
That is very sweet of you. I feel like sometimes it's just nice to, I don't know. I've been through it, guys, right? I've been on that aisle where I'm like, should my vagina smell like a peony? Probably not.
I've had BV, I know. Also, BV, that's a
You could do a whole
story.
episode about BV. Oh my gosh, I know.
Which we will. We want to have you on. You're the BV queen, right? We want to have you on for that.
Oh my gosh. When I first started at our practice and like my schedule wasn't filling up quite yet. And so it was like a lot of like the same day problem appointments. They'd call and they'd be like, I need to be seen right now. And the secretary's like, we have our new PA if you want to see her. And like, when do you want to be seen immediately, right? When you have like funky discharge and you have like a fishy odor coming from your vagina and you're like, what is this? And so I was seeing just patients with BV nonstop. And then so one of the doctors in our practice, she was like, you're like the BV queen. And I was like, I don't know if that was the nickname I was hoping to acquire so early in my career, but thank you. I will wear it like a badge of honor.
But women need people like you who are just like kind and open and gonna make light of the situation, because that is such a horrible feeling.
Guys, what is BV?
So sorry. Bacterial vaginosis.
Ooh,
It
yummy.
is, I know, right? It is an overgrowth of a couple different kinds of bacteria in the vagina. There's always bacteria in the vagina. There's good bacteria in the vagina that should be there called lactobacillus. They create lactic acid, and that's what makes the vagina have like a slightly acidic environment, which is actually great, and that's why it shouldn't smell like water, guys.
Mhm.
But and that usually is what prevents infections and prevents other type of bacteria overgrowing. But sometimes, bad luck, things happen, and a certain kind of other bacteria or bacterias can overgrow and kind of become the more predominating bacteria.
Huh.
And they secrete these things called amines, which have this very classy, fishy odor and kind of changes your discharge, can sometimes be a little bit irritating. And you have
Mm.
bacterial vaginosis, and it is no fun.
Hmm.
Yes.
But it's super
Oh,
easily treated.
Okay.
okay, what is the most common piece of advice or education that you give women in the office?
Maybe not to beat a dead horse, but probably it is to like add weightlifting into your routine.
Yeah.
Because I feel like no matter what season of life you are in, it is so important. For young women, I like, transitioning from my college metabolism, which was incredible, and then adult metabolism. And I was like, whoa, I'm having to work a lot harder to like maintain a healthy weight. Weightlifting was super helpful for that. One of the big GYN buzzwords is PCOS. Managing PCOS, one of like the foundational aspects of doing that is weight training. Perimenopause, postmenopausal patients, it's really helpful for them to kind of help maintain a healthy weight going through that transition, helping with your appetite, better sleep, better mood, stress relief, sex drive. And then also, like, even as we get older, wanting to prevent things like osteopenia, osteoporosis, which is like
Mhm.
loss of your bone mineral density, which increases the risk of fractures. So, starting weight training, weightlifting at a young age has been shown to reduce the risk of bone loss later in life. If you think of like these little old ladies where it's like, oh my gosh, I feel like I could sneeze on you and you might like break a hip. So, wanting to not be that little old lady, be strong. That is like the casual advice that I try and give most of my patients.
Hmm. That's
That's
great.
yeah.
Love that. All right, well, let's get into our topic. So today we're talking about birth control, and I think it's going to be really, really helpful because there's a lot of misconceptions about birth control, and there's also not much education about birth control unless you were to go spend time with someone like Megan who can teach you about it in the office, which some people just haven't had a chance to do that, or they don't find someone who's willing to really sit down and educate. So lucky you're here because you can talk to us about it. So
Happy to help.
first, yes, just walk us through the basics of the menstrual cycle and why it's important to understand that to then understand how birth control works in a lot of ways.
100%. I feel like this is a really good place to start. We were probably taught this in like sixth grade health class, and then right, that quickly evaporated from our brains, and then we haven't
Yes.
touched back on that in a while. Most women want to have a good understanding of how their body works, right? And so I feel like that gives you confidence and you feel empowered, and then that can make understanding birth control so much easier. I feel like there's like it's almost shrouded in mystery of like the female body is so complex. We can't understand it, but like we absolutely can. Yeah, women's bodies are so cool and so interesting. But I also, while I'm, getting into the weeds, my main message is like, this is not as complex as you think.
Mhm.
So there's two cycles going on at the same time. One is the ovarian cycle, and then the other one is the menstrual cycle or the uterine cycle, if that kind of makes sense. So these overlap and are happening at the same time and kind of combine to make the reproductive cycle that we kind of all think about. And so the ovarian cycle is the process in which the ovaries are stimulated, a follicle is stimulated to the point of development, and then it's a mature egg, and then it's going to be released via the process of ovulation. So that is kind of the process that's going in the ovaries. The menstrual cycle is the process by which the lining of the uterus is getting stimulated to thicken, and then it is shed. And then that shedding is when you get your period. That's when you bleed on your period. So both of these cycles happen over about a 28-day process. It's about a month long. 28 days is like the median, but not everybody is a 28-day cycle person, right? A normal cycle is anywhere from 21 to 35 days. So I don't get me wrong, I have some people who have the perfect 28-day cycle and down to the minute they're like, I know when my period's gonna come. And I also have a lot of people who are like, I have like a high risk 5-day period where like, it's coming. I don't know when,
Yeah.
but probably soon. Those things are totally fine. I have a lot of people come from like, my cycles are irregular. They come anywhere from like 23 to 26 days. So I'm like, that's awesome. That's perfect. That is not an irregular cycle. Anyway, 28 days, both of these things are happening. And both of these processes are driven by hormonal signaling. And I feel like hormones, I think people are talking about hormones a lot more, and they can be made to sound like very complex and very confusing, but really all they are, hormones are long distance chemical messengers in the body. They go from one place in the body to somewhere else in the body, and they tell it to do something. That's all really hormones are. The hormones that are involved in like kind of the reproductive cycle are coming from the brain, two places in the brain, the hypothalamus and then the pituitary gland, and then going down to the ovaries. So those are our hormone secreting, communicating organs, if you will. And so that's what kind of hormones are going to be what drives the ovulatory cycle and then also the menstrual cycle. So those hormones are LH, which is luteinizing hormone, FSH, which is follicle stimulating hormone, and then estrogen and progesterone, which I feel like everybody's heard of estrogen and progesterone, but don't sleep on LH and FSH because those are also really important. So the ovarian cycle, that is kind of split up into 3 phases, if you will. So there's the follicular phase, the ovulatory phase, and then the luteal phase. So the follicular phase is about day 1 to 14 of your cycle. We'll circle back on this, but day 1 of your cycle is when you start bleeding on your period. Because I think most people track their cycle based on like when their period comes. So remember, day 1 of the cycle is when you start bleeding on your period. Okay, back to the follicular phase. So follicular phase is about from day 1 to 14-ish of the cycle, and that's when the ovary, it switches sides each month. So it's like one ovary one month and then the other ovary the next month, usually. It is stimulating a follicle, and over time it's going to kind of develop into a mature egg. So that's this process. It is driven mostly by estrogen and then also FSH, follicle stimulating hormone. So we're stimulating this egg to be developed, and now it's mature, and now it's ready to ovulate. So we have the ovulatory phase. This tends to happen around day 14 in the cycle. Ovulation obviously is like a moment. It's when the egg ruptures through the wall of the ovary. It's very exciting, a little bit violent.
It's so crazy.
So like, crazy.
Okay, so just real quick, you have your uterus, which is like a big sac. That's what the egg would eventually implant in. There's these little tubes called the fallopian tubes. Those connect to your ovaries, which, do you know how big an ovary is? It's pretty small, right?
It's about the size of like a nut, like this. For like a woman who is premenopausal, you have active functioning ovaries. They're about this big usually. And then your uterus is about the size of a pear usually.
Oh, so little.
I know people think it's giant, but if it doesn't have a baby growing inside it, it's pretty small actually.
So little. So when it ruptures through the wall of the ovary, it's pushing out into the space. Explain what that is real fast, just so people can kind of visualize it.
Yeah, this is kind of crazy. So the ovary and the fallopian tube are actually not directly connected. There is a moment when you ovulate, this egg is just like floating in the pelvic cavity, right? It is there. And this, we'll probably touch on this later, but this is kind of when after this process happens, you have a rise in your basal body temperature because your body almost senses that there's like a foreign body inside your pelvis. And it's like, oh my gosh, is this an invader? Is this something that shouldn't be here? It's almost like not an infectious response, but an inflammatory response. But so the egg ruptures through the wall of your ovary. It's like floating in free space. And there are fimbriae or fingers that are at the end of your fallopian tubes that grab the ovary. And then, I'm sorry, not grab the ovary, they grab the egg and they shimmy it down the fallopian tube and then into your uterus. So just the process that you can even get an egg into your uterus is kind of wild, but like the body is so cool.
Yeah.
Wow.
Right. Okay, so we had an egg that has ruptured through the wall of the ovary, which again is a little violent.
Wow.
But like that's why. So like sometimes I feel like my cramping during ovulation is worse than when I'm bleeding. So is that why? Like it's the little fingers and like grabbing it through and pulling
fingers so yeah, some people feel ovulation and you can have some cramping, and there's also like a little cyst that's left behind from where you ovulated from. Some people feel ovulation, which is really, really cool. So yes, 100%.
Is that Mittelschmerz? Is that the right term?
Yes, okay. The German word. Yes.
Yes.
There's a German word for everything.
1 egg per period.
Correct. Yes.
Okay.
Yes, usually. Yes. So ovulatory phase, and then the last phase is the luteal phase. So this is after you've ovulated and your body's like, are we going to get pregnant? And so there's kind of a surge in progesterone during this phase. And then that progesterone kind of surges and then it kind of slowly tapers off. And that withdrawal, that decrease in progesterone is eventually what's going to trigger your period to start. So that's the ovarian cycle. That's kind of what's going on with the ovaries. And then we have the menstrual phase, which is going on at the same time. And so this one is only broken into 2 phases, the proliferative phase and then the secretory phase. So this is the thickening of the lining and then the shedding of the lining. So day 1 of the cycle, again, is when you start bleeding on your period. So day 1 of your period is actually you're in the follicular phase. Your body's already getting ready for your next period by the time you're starting this one. Craziness. So while you're bleeding, the uterine lining is shedding, but then we start to see kind of a rise in estrogen, right? Because estrogen was playing a role in developing the follicle. Estrogen is the hormone that's responsible for thickening the lining of your uterus. And so it is thickening the lining of your uterus, kind of preparing it to be a hospitable place for an embryo, right? If we ovulate and then a mature egg is shimmied down into the uterus, and if it's fertilized and we have an embryo, it's going to become a pregnancy. It needs a nice juicy uterus to kind of settle into or embed into, and so it thickens the lining of the inside of the uterus. So rising estrogen is thickening the lining of the uterus. You have ovulation, and then in this luteal phase, we have progesterone. Progesterone kind of stabilizes the lining of the uterus. It's like, hold on, let's see if we get pregnant. Let's just hold on to this. And then, if you don't get pregnant, that progesterone level falls, and that decrease in progesterone triggers the secretory phase, and that's when you start your period. So we call it a withdrawal of progesterone, essentially, is kind of what triggers you to bleed. So
That's so cool.
That's the menstrual cycle, the ovarian cycle, the reproductive cycle. It's so interesting.
It is so cool. And it's cool because I think recently people have been giving more respect to the ovarian and the menstrual cycle as almost like a sign of vitality and health for women. Because I think for so long it's been like, ew, periods, like, ew, girls are gross, and it's like, no, that's a sign that you're healthy and your body is functioning well. And you should, I mean, now that I think I understand that, I actually get not excited, but I feel good when I start my period for the month because I'm like, okay, my body's doing what it's supposed to do. It's functioning well. And so I don't know, it's cool to understand why that's happening.
100%. We kind of think of the period as the 6th vital sign, right? Where it's like that is, if you don't have your period, it's usually, and you're not like on some type of birth control, we're not suppressing it on purpose. If you don't have a period, then it's usually like, oh, is there something wrong here? Is your body trying to tell you something? So I feel like, yeah, having a regular period can be very reassuring that you are, from a physiologic standpoint, things are good. Your body is happy.
Yeah.
Well, you even said when I was saying that I cramp when I'm ovulating, you're like, oh, like some people do that. That's so cool. But my first reaction is like, oh, that sucks. But you're right. Like it's a good mindset. Like think about what my body is doing and producing all on its own. That is really cool.
It is cool. And I feel like just understanding what's happening, like, no, it's not awesome that I'm cramping, but like, hey, I just like felt myself ovulate. Well, little middle schmerts going on in the middle of the day.
Yeah, no, you should start saying that, Eden. Like, oh, middle schmerts coming through.
What you gonna do?
But wait, I have a question. So how long does like the ovulatory phase? That sounds like just a moment.
You're so right. Yeah. So the ovulatory phase is triggered by I think I forgot to say this. It's triggered by a surge of LH or luteinizing hormone. That's kind of what pushes the egg out, if you will. That is about a 36-hour phase. Ovulation itself is like, boom, that the egg ruptured through the wall of the ovary, but that surge in LH and kind of pushes the egg out. And then you have this like free floating egg. And that whole process is 36 hours, which is much shorter compared to the follicular phase before it. And then the luteal phase after it. So you're right. Ovulation is so much quicker than the other phases. The actual physical act of ovulation is super quick, but that phase is like maybe about 36 hours or so.
Okay. And you said it alternates like one egg from the left, one egg from the right. Are we born the same amount in each? Wait, where are they coming from? Ovaries?
Yes. Yeah.
Okay.
You're so correct. Yes. Yep. Should be about even. And most people, one egg from one ovary on the one side and then alternates each month. But sometimes, the body's not perfect. And sometimes people will ovulate from both ovaries, and sometimes that's how you can get twins.
Yes. And are we
2
all
eggs.
born with the same amount of eggs?
Yeah, I mean, sometimes people, people can have different disorders where maybe they don't have quite as many as others. But you are born with all of the eggs that you're going to have, which is very different from men who they make new sperm on a daily basis, honestly. But we are born with all of the eggs that we're going to have, which is really cool.
Cruzy and I
That's
have
cool.
talked about this before because it like kind of freaks me out, but it's also really cool. So like when you're pregnant and you have a little girl inside of you, when does she have all of her eggs?
When she was fertilized.
Oh my gosh.
When you're pregnant, you are like also holding your
That's
grandchild.
what I'm saying. That's what I've
Yeah.
been saying, and no one
Yeah,
gets
you
it.
are. It's
That's
totally true.
crazy.
It's
That's
Wait,
totally true.
why do I think this was on the Kardashians where she's like, Chris is like, I birthed your baby. You don't realize
I
this, but
actually did all of
I
it.
I made your baby. It wouldn't be here without me. It's so
What a Kris
funny.
Jenner vibe to be like, this is me. I did
This is me.
this.
It's all me. Yeah.
She's like, I made you and everyone else.
But that is
Okay.
so cool. Like you're carrying like multiple generations.
100%.
Whoa.
Okay,
Mhm.
so that was a very helpful foundation. So now let's talk about the different kinds of birth control and basically just pros and cons of each, who does well on different types. Just take us through whatever you want with that.
This is a spiel that I give so often in practice because people are like, what are my options? I kind of like to think about birth control in two big categories. The main types of birth control that people think about are shorter acting methods and then our longer acting methods. So the shorter acting methods are things like the pill, the patch, and the vaginal ring. And then the longer acting methods are things like the IUD and then the Nexplanon arm implant. There's also one kind of in the middle, and I don't know which category to put it in. We'll talk about it in a second. So starting with the short acting methods. You have the pill, the patch, and the ring. These all work really similarly in the sense that they are systemically dosed estrogen and progesterone. So when we say like systemically dosed, right, meaning like your whole body is essentially getting a dose of those hormones. So it's a low dose of estrogen and progesterone, and it's just like a steady state of those hormones all month. And how that ends up working is it suppresses ovulation. So when you're having your normal, if you're not on birth control, you're going through a monthly cycle, you're having these fluctuations, these up and down hormone levels. When you're on hormonal birth control, the pill, the patch, the ring, just a steady state of hormones, and that suppresses ovulation, kind of tells your brain, like, I've got this, hold on, no need to send these hormonal messages. And obviously, if there's no egg, then there's no pregnancy, and that's how we prevent pregnancy with these types of birth control. The other kind of perk of these can sometimes be, since it is a low dose of these hormones, so it's a low dose of estrogen that's in the pill. Like we said, estrogen is the hormone that thickens the lining of your uterus, and so it kind of works to thin the lining of the uterus, instead kind of keeps it nice and thin. So one of the perks of being on hormonal birth control can mean it can make your periods lighter and less crampy. It can also kind of help to regulate them. So, we're on the pill, the patch, the ring, and then at the end of whatever method you're using, we kind of have some sort of placebo effect. So like you have the end of the pill pack has the placebo pills. If you're using the patches, you have a patch-free week at the end of the month. Or if you have the vaginal ring, you leave it in place for 3 weeks, and then with the 4th week, you take it out. And so what that is mimicking is that withdrawal of progesterone that we talked about. So towards the end of your cycle, the progesterone level starts to decrease, and that's what triggers you to get your period. And so what triggers you to get your period when you're on these types of hormonal birth control is the absence of progesterone. So you're no longer taking a pill or using a patch or wearing a ring that has progesterone in it. We just took it away. And so that triggers your uterus is like, oh, I guess I should bleed. Does a little bleed, usually lighter, less crampy, and then you restart the pill, replace your patch, or put the ring back in. So those are kind of how those methods work. Does that make sense?
Cool. Yeah.
Yes.
What's the patch? I'm not familiar with that one.
I feel like sometimes the patch is less talked about. The pill everybody knows about, right? You take a pill at the same time every day. The patch is a patch that goes on your skin, usually like on your lower abdomen or upper back. And some people who are like, I want the benefits of doing hormonal birth control like the pill, but I can't remember to take a pill every day. I'm like, can you remember to change a patch once a week? So you put a patch on your skin, you change it once a week, and then after 3 weeks, you have a patch-free week to allow for your period. Some people are like, I can't even do something weekly. I'm like, all right, could you do something once a month? Could you put a ring inside your vagina and you leave it there for 3 weeks, and then once a month, set an alarm in your phone, pop the ring out, leave it out for 4 to 7 days, have a period, put a new one in. So they work all in the same way, but it's just kind of like How responsible can you be about this? I have
Mhm.
some people who are awesome pill takers and some people who are very self-aware and they're like, I'm not a good pill taker. I'm like, so let's not have a pill be the way we don't get pregnant, right?
Mhm.
Mhm.
With the short-acting methods, like how effective they are in preventing pregnancy,
Yeah.
they're about 95% effective in preventing pregnancy. And a little bit of that is like perfect use versus typical use, right? Like
Mhm.
people aren't perfect. And so sometimes people forget their pills. They forgot to replace their patch. And then we have the longer acting methods. We call these LARCs, long acting
Larks.
reversible contraception. So it
Ooh.
can work for a long time if we want it to, but also as soon as we don't want it, it is immediately reversible. So we can have a pretty much immediate return of fertility when we stop them. So these are things like the IUDs and then the arm implant. The brand name is Nexplanon for the most common one that's used. The long acting methods, so the Nexplanon, the arm implant, and the IUDs are over 99% effective. So that's a cool thing. And they have this nice aspect of it's just like set it and forget it. So the next one on is like a little bar, plastic bar that goes just underneath the skin of your arm. It works by secreting progesterone only. So there's no estrogen that's in the Nexplanon. It does also work by suppressing ovulation. So it keeps your body at this kind of steady state of progesterone. So it tells your body no need to ovulate here. And then it also works to thin the lining of the uterus. So it's going to make your periods lighter, less crampy. So the
Mhm.
arm implant is good for up to 3 years, which is really, really cool. The bleeding pattern can be a little bit less predictable sometimes with the Nexplanon. Some patients have a regular monthly period that's just like lighter, less crampy. Some people have lighter bleeding that happens maybe every couple of months. Some people don't bleed at all, which is kind of awesome. You don't have to worry about having a period because sometimes it's inconvenient. While it could be cool to like see your body's natural physiologic process, especially if you have a problematic period, it's very heavy, painful, what have you. Sometimes just like not having it is awesome. So that's the next one on arm implant. And then we have the IUDs. So IUD stands for intrauterine device. So it's like a little T-shaped guy that we place through the vagina, through the cervix, and it sits inside the uterus. There is a hormonal and non-hormonal IUD. So the non-hormonal IUD is also called the copper IUD. Fun fact, copper kills sperm. That's like really how the copper IUD works. It doesn't have any hormones, which some people really like. Some people don't want to have hormones. Some people can't have any hormones. Sometimes one of the downsides of this one is it can make your periods a little bit heavier, crampier, and longer. Just because like there is a foreign body inside the uterus,
Mhm.
but we don't have hormones making the periods lighter. But some people, if they have like a lighter or, less crampy period at baseline, they're like, I could handle this. Like that would be fine if my periods got a little bit more intense. Sometimes people are coming to me and they're like, oh my gosh, my periods are so heavy. They're so painful. I need you to fix this, Megan. Oh, and I don't want to get pregnant. I'm like, I don't know if the copper IUD is our friend. I'm going to make this worse for you and you're going to hate me.
Mhm.
um, so then we have the last, which is the hormonal IUDs, which I think are like becoming more popular now. So these are IUDs that secrete progesterone only. So no estrogen with these, just progesterone. But the thing that's unique about the hormonal IUD is it's not working systemically. It is just working inside the uterus. So it's very different from like the pill, the patch, the ring, right? And the Nexplanon. Those hormones were working in your whole body. It was suppressing ovulation. Hormonal IUD does not suppress ovulation. You, from a systemic body standpoint, you keep going through your monthly cycle, but how the progesterone in the IUD works is it works to thin the lining of the uterus. It's kind of part of how it prevents pregnancy. It's not the only way, but the perk is that it's going to make your bleeding lighter, cramping less. Some people don't bleed at all, but it's not because you're not going through a monthly cycle. It's just because the lining of the uterus is kept nice and thin. So that can be kind of a happy medium. And sometimes people are like, hormonal birth control, systemic birth control didn't work well for me. I can't do anything hormonal. I'm like, what if we avoided systemic hormonal birth control? What if we did just
Mhm.
like localized hormonal? I feel like that can sometimes be like, gets lost in the mix with the hormonal IUDs. There was
Mm.
one that I didn't mention because it's kind of in the middle and I don't know which group to put it in. It's the Depo-Provera shot. So this is a shot that you get once every 3 months. And I don't know. It depends on who you ask. Is that long acting or short acting? But the Depo is a big dose of progesterone. And so a lot of people don't bleed on the Depo shot. So that one's kind of in the middle. That one's been around for a long time. That could be a good fit for some people, but sometimes the side effect profile does kind of make people hesitant about the Depo. The long-term use, there could be loss of bone mineral density. So we talked about like keeping strong bones. That can be sometimes one of the drawbacks of the Depo shot. But she's been around for a long time. It can sometimes be a good fit for certain kinds of people.
That's so helpful to have those categories. Just a few questions on side effects because, as we all know, any medicine, supplement, anything you take, implant, device, comes with side effects,
Mhm.
even if it's a great drug and it's the benefits outweigh the risk. I think it's always helpful to know the side effects. So tell us which type of birth control is more associated with weight gain. I know a lot of people have that
Yeah.
question.
That is hands down one of the most common questions that I get asked. The only like birth control method that I mentioned that has like a data associated risk of weight gain is the depot shot. When I counsel people about weight gain and loss of bone mineral density, they are naturally a little bit hesitant. But in like the studies we have done about like the pill, the patch, the ring, the next one on the IUDs, we did not see a data associated risk of weight gain, meaning like it wasn't like we saw, you know, a 10% chance that you're going to gain 5 pounds on XYZ method. I will say, anecdotally, I will definitely sometimes start people on any of those methods. Maybe like I have an 18-year-old, she comes to me, she's like, I'm going to college, I need contraception, and I start her on the pill. And she comes back to me in December and she's like, Megan, I gained 20 pounds. Like, we
Wow.
need to fix this. And it's like, okay, was it from the pill? Was it from going off to college?
Yeah.
Who's to say?
Fear. Yeah.
Right? Who's to say? But you know what? I definitely have had some people where it's like, I started them on the pill, they changed nothing about their life. They gained weight and then we stop the pill and they lose the weight. So it's like,
Yeah.
who am I to tell a person like, no, that's not what happened. So to answer that question, I usually just tell people that like very much on an individual basis.
I also love that about you because I think we're in this era of like a lot of mixed messages about data driven and like evidence-based medicine versus individualized personal experiences. So to be able to hold both of those and put them together in a way that is helpful for the patient, I think is key. So sounds like you're doing a good job of that.
We try.
Okay, how about acne? Are certain types of birth control associated with helping or hurting acne, making it worse?
For sure. Definitely one of the things we can start people on birth control for. The systemic methods of birth control are usually going to be more helpful for acne, right? So like an IUD that's just working locally inside your uterus is going to do nothing to help your face, right? Because it's just working inside your uterus. So typically those hormonal methods are going to work a little bit better. I feel like oftentimes people are on the pill for their acne more so. There are all different types of pills. There's so many different formulations of pills. When someone comes to me for help with acne, I'll usually choose a certain type of pill that has drospirenone as the type of progesterone. Not to get into the nitty gritty, but there are different types of progesterone that can have either like testosterone fighting effects versus not so much. And so people, especially with hormonal cystic acne, like the awful, just like big painful pimples, that is kind of hormonally driven is usually from like a little bit too much testosterone. And so drospirenone kind of helps to decrease the amount of that circulating testosterone. So it's really helpful for hormonal acne. So yes, usually, I mean, other pills can do it. The patch, the ring can also be helpful. But if that's like what people are here for like come to see me for, and they can take a pill every day, let's do a pill that has drospirenone as the progesterone component, 100%.
Very helpful. And then I've heard, again, maybe anecdotally, people that are on progesterone only, like specifically the IUD, sometimes it could actually make the acne worse. Do you see that in patients?
I feel like kind of mixed with this. I feel like sometimes people will transition from the pill to the
Mm,
IUD. And so sometimes like going from systemic to local, like they didn't realize, oh my gosh, was the pill helping with my acne? I didn't realize until now I don't have it helping. The type of progesterone that's in the progesterone IUDs, it is working locally. Yes. However, like your uterus is connected to the rest of your body. So there is, of course, a very, very small amount of the hormone that's going to be absorbed systemically.
yeah.
I don't tend to see it being enough to cause systemic side effects, but occasionally I'll see someone who had like a surge of acne and they weren't on the pill before this. We just did the IUD.
Hmm.
I would say like when I've been talking with other providers, I feel like maybe 5% of the time people can see a little bit worsening acne with like a hormonal IUD. So sometimes it's something that gets better with time. Sometimes you can see your dermatologist and they can do things for it. Sometimes we're like, okay, maybe the hormonal IUD wasn't a good fit and we can pivot.
Okay, how about libido? Is there any association of increase or decreased libido with these different kinds of birth control?
Such a good question. It kind of goes to the physiology. I'm glad we started with the physiology of this because we keep on touching
Yes.
back on it.
Also
So,
define libido. if you
Sex drive, we want to have sex. So that is your libido. High libido, I want to have sex. Low libido, I don't want to have sex right now. From the follicular standpoint, from the ovarian cycle standpoint, our libido will naturally kind of rise with ovulation, right? Because just from like an evolutionary standpoint, we're supposed to be making babies, right? That's what our science, our biology wants us to do. And so most women kind of have an increase in their libido around the time of ovulation. Not everybody. I mean, some people have, higher sex drives at other times in the cycle, but from a physiologic standpoint, we should see higher sex drive at the time of ovulation. And so then you're thinking, okay, well, we just said that a lot of those systemic hormonal birth controls suppress ovulation. So then do you see really low libido with systemic birth controls? But actually, in the studies we've done about it, it is very split. So some women saw that they saw a decrease in their libido. Some women saw that they actually saw a little bit of an increase in their sex drive. And then some women saw that it was unchanged. So this is kind of another one of those things that, like, when people ask me that question, this is how I answer it. And I'll be like, so let's take it on a, case by case basis. If I start you on this birth control pill and you no longer want to have sex with your boyfriend, then let's pivot and maybe we do something that's not systemic.
Very helpful personally from my experience, because I remember talking to my gynecologist about this. I had the Kyleena before I wanted to get pregnant. So that's the progesterone only IUD. That one lasts, is it 5 years or 3 years?
5 years.
5 years. Mirena is 8 years. Copper is 10?
Up to 10 to 12, yeah.
Wow. Okay. Is there another one now?
Liletta is another brand that has the same amount of progesterone as Mirena, just different brands.
Mirena.
I love all the names. Kyleena.
They're just like these like vaguely feminine names, I know.
Anyway, I had the Kyleena and I noticed a big change in libido.
Like you said, there's a place for the data and then there's a place for like what's happening on an individual basis. And I feel like at the end of the day, women just want to be heard. And there's so many options for birth control. So it's like, if something's not working well for you, like, let's pivot, let's do something else.
Yeah, I like that. Let's talk about which type of birth control is generally best tolerated.
That's something that patients ask me all the time. They're like, which one's best though? Like, which one do you like the best? There's no right or wrong answer because they all have their pros and cons, like you said. I'll kind of ask the patient, I'll be like, what are your goals? Are we just preventing pregnancy? What do you want to prioritize? Are we also trying to help with acne? Do you have really heavy, painful periods? If you do, then we're not going to do the copper IUD and make it worse. I have some women who, like, for one reason or another, they maybe can't do hormonal methods, or maybe they can't do estrogen containing birth control specifically. And so that can help direct our choices. I have some women who we start on systemic birth control because we are trying to address PMS or PMDD. So premenstrual dysphoric disorder is essentially like the more severe form of PMS. And it can be really debilitating. I mean, I have patients who they have like suicidal thoughts and ideation every single month during the luteal phase, which is like not
crazy.
It's awful. And so we use systemic birth control to suppress ovulation instead of going through the luteal phase, which we don't. We avoid the luteal phase. So kind of depending on like what are your goals, what are your priorities? Do you want to have a monthly period? Are you okay if it gets later? Are you okay if you maybe don't see a bleed every month? Those are kind of the priorities that patients have. We can usually find something and meet in the middle that meets all of those things.
How do you talk to patients who, like me, might be a little hesitant about suppressing their period and being concerned about that as a systemic effect? How do you talk about that? Like, is it actually okay to not be having a period for years and years?
Yeah, I think that's a good question. As far as we have seen data-wise, like, yes, we haven't seen long-term effects of like not having a period. And I think that sometimes when I explain again the physiology of it, so sometimes women when they're on a low-dose birth control pill will maybe not bleed. Like even when they get to those placebo pills, maybe they don't bleed. They come to me, they're terrified. They're like, "Oh my gosh, I lost my period." And so then I can kind of back up. I'm like, so this is maybe a shocker, but it was actually a fake period to begin with, right? It's more of it was a withdrawal bleed is maybe kind of a better way to talk about it. And so then I'll explain like, it's a low dose of estrogen, so it's keeping the lining of the uterus thin. And so sometimes you don't necessarily need to shed it. If you're not having a period because we are suppressing it on purpose, that is okay with me. However, if you are not having a period and you're not on hormonal birth control, or if you're just not getting a period, that is something that we very much need to look into. There are some women who come to me and I explain to them that like it's a fake period on birth control pills, the patch the ring, and they're like, I don't like that. I want to see like my true period. I'm like, okay, let's prioritize that. So it's like that's a very realistic thing. And I also think we didn't necessarily talk about some of the other types of birth control. that sometimes people use. I mean, throwing it back to the tried and true, like condoms, right? Condoms are great. It's also sometimes people use like the rhythm method, or we call it natural family planning. There are other ways to prevent pregnancy. They might not be as efficacious in preventing pregnancy. So condoms are about 85% effective in preventing pregnancy with how most people use them, right? We got to stop in the heat of the moment, right? We got to put a condom on. We got to find a way. It can't fall off. It can't break those things.
Yeah.
So I think like those things are not to also be forgotten. Those can work too. Maybe not quite as to the same efficacy as the other birth control methods. But again, it's all about priorities.
Do you know how efficacious the pull-out method is? Is it probably all depends on the person, how regular their cycle is, how quickly they're pulling out, like all of that stuff.
Right. Yeah. It's like about the same as condoms at the end of the day.
Okay.
The other perk is that, condoms are helpful in preventing the spread of STIs, sexually transmitted infections, but like none of these other methods that I mentioned help prevent STIs. So it's like, there's that to be considered. A lot of times people are, when they're trying to decide what type of birth control, also they're comparing, side effects, risks and benefits. And I think they're sometimes comparing it to the risk and benefit of being on birth control versus being off birth control. And I'll sometimes kind of reframe that thought process where it's like, if you are sexually active and we're not doing anything to prevent pregnancy, there's about an 85 chance you'll be pregnant within the next 12 months. So let's kind of reframe our thought process of what are the risks and benefits of being on birth control versus what are the risks and benefits of being pregnant, right? That's oftentimes the most dangerous thing a woman will do in her life is be pregnant. It's a very serious thing. It's so cool. It's so awesome. It's so wonderful and beautiful, but it's also can be really dangerous. And so I think sometimes that kind of sets it into perspective.
Okay. You mentioned this a bit earlier, but I'm curious. You said the LARCs, the long-acting reversible contraceptives, are cool because pretty much directly after you remove the IUD or the Nexplanon, you could get pregnant. Like within that next cycle, you would still be ovulating, and then you could get pregnant. I'm curious because a lot of people have questions about return to fertility after getting off their birth control. And so I'm curious what the data is and what you see in practice on the relationship between different kinds of birth control and return to fertility, and how you counsel them on when to stop their birth control based on when they ideally want to get pregnant.
Yeah, such a good question. Yes, pretty much immediate return to fertility. It's gonna vary a little bit based on the method and how it was preventing pregnancy to begin with. So, for example, if I pull someone's IUD for one reason or another, I will ask them, "Have you had sex within the last 5 days?" If you have, sperm can sometimes live for up to 5 days after ejaculation, and we're not suppressing ovulation with an IUD. And so if I now remove the thing that was preventing pregnancy, and maybe there's some like really spunky sperm who have survived, and now there's an egg they could fertilize, you could have almost immediate conception when I remove an IUD. So like when you put it into that perspective, like it could be really immediate. But also, especially more so with the hormonal methods, part of how those were working is they were thinning the lining of the uterus, right? Keeping it nice and thin. And like we said at the beginning, we need a thick, juicy endometrial lining for an embryo to implant. And so sometimes it can take a little bit of time for, if we were suppressing ovulation, for your ovaries to wake up and start to ovulate again. It can take a little bit of time sometimes for the lining of the uterus to thicken back up and become kind of a hospitable place for an embryo. My grace period, especially for the hormonal types of birth control, is about 3 months. You should get back to having a regular monthly period within 3 months of stopping birth control. And if you haven't, let's investigate why. People are like, I want to be pregnant in 6 months. Like, when should I stop taking my birth control? And I'm like, you should stop taking your birth control in 6 months.
Okay.
You should, whatever your type of contraception is, keep doing it until you would be happy with a positive pregnancy test tomorrow.
Yeah.
I think that sometimes, sorry, go ahead, Eden.
You might need to finish, but I was just curious if there are higher chances of miscarrying or like high risk pregnancies right after coming off birth control.
That's a good question. Not that we have really seen. It's kind of if the lining of the uterus isn't ready yet for an embryo, then it won't implant, right? It's just we just won't get pregnant that month. It'll only happen kind of when it is time, when it's a hospitable place for an embryo. I think sometimes people will read they should, stop at 3 to 6 months before they want to try and conceive to allow things to regulate. And you can do that if you want to, but we run the chance of getting pregnant in the meantime. So what I usually tell people is when you are ready to be pregnant, that is when you should stop your form of contraception. And I also tell people, sometimes I feel like this is maybe something people don't know is an option. I tell people to come and see me for like a preconception counseling visit, right? Like when I remove your IUD, first of all, I'm gonna be like, why are we taking this out today? If the point is to get pregnant, sweet, let's talk about that. Let's talk about how do you track your cycle? How do you time intercourse to conceive? What are the do's and don'ts of when you're trying to conceive? How long are we trying to conceive before it's concerning if we haven't had a pregnancy test? Some of the testing that we can do before pregnancy. So that can be an important time to also connect with your provider and talk about it.
That sounds like
Let's
that
have
should be another
one.
episode. Yeah.
Yeah.
we're coming up with new BV, PCOS, all the things.
I just feel
we're
like
not done with you.
Yeah. Maybe I'm like in the minority, but I'm like, I have a high school degree, college, master's degree, and this stuff is very foreign to me. Like it's exposing, oh wow, I really don't understand that part of my body. I think that's probably a lot of the general public. And I think it's, again, the whole point of this podcast is like we need to know our bodies, to take care of our bodies, to take care of other people, maybe the bodies that we're creating with our bodies. So this is so good.
Yeah, I feel like I loved why you guys started this podcast, is just to like teach people about their bodies, especially teaching women about their bodies. I feel like sometimes I give that whole birth control spiel and people are like, no one's ever just like told me all of the options at the same time. And like maybe I'd talk their ear off for 25 minutes telling them all about their options and they haven't decided, and then we're going to circle back on it, but they're like, okay, well, at least I have this information now.
Yeah.
Yeah. That's
Cruzy,
awesome.
I have a weird question we don't have to include, and I'm going to try to figure out how to ask it. But
Go ahead.
for systemic birth control, you are not ovulating, correct? Like an egg is not breaking through.
Correct. You're keeping your body on a steady state of estrogen and progesterone. And so that stops your brain from sending the hormones to your ovary, telling it to then develop a follicle. It kind of like overrides your brain's hormonal messaging, and it plays into the feedback loop between your brain and ovaries, and it kind of halts it. It kind of tells your brain like, you don't need to do this. We're just going to stay right here. So that's how it kind of prevents ovulation. Does that make sense?
Yeah. So with that in mind, is there any thought of maintaining your eggs for like older age or something?
I had this thought, and this was actually pretty late in my like education game. I was like, wait a second, because I was on birth control pills for a long time, and I was like, okay, if I'm not ovulating, does that mean I am just like racking up my eggs? Like if I just like holding on to these and I'm just like a fertile myrtle whenever I decide to come off of the pill? And it turns out, no, you like the eggs that you are not ovulating will kind of get like reabsorbed over time. I know, I wish you could like save them and cash them in. I had the same thought. But it turns out I did some research of that and I'm like, oh, that's not true. That's a bummer.
Yes.
I figured you can't be like 80 and like, you know,
yeah, you're like, no, but I suppressed my ovulation for 40 years, so now this is my time to shine.
Yeah. I think that was a concern. That's some misconception circulating around on some social media platforms, is people who do IVF and are retrieving eggs, that potentially that would be decreasing the amount of eggs they have for future cycles, which is also not true, right? Because you're just collecting the eggs that otherwise after that one cycle would have been discarded.
That's
right?
a good thought. Yeah, but we don't tend to see people who went through IVF then going into like premature menopause or premature ovarian failure.
I think that's helpful.
Yeah, because you don't end up ovulating every single egg. Like they don't, the body isn't perfect. We don't always, process and develop every single follicle that was there.
There's one egg that's chosen, and then that egg, if a sperm even makes it to the egg, has to receive the sperm, right? Like it could say yes or no.
Yeah, yes. The process of fertilization, it is incredible that we're even in existence, right? We should all have a crazy amount of confidence of like, I am made up of like this miracle sperm that survived this treacherous journey through the vagina, the cervix, against all the odds, and I'm an egg that was like, I accept you, I am perfect. I made it from swimming in the free space that was your pelvis, and I was picked up by the fingers, and I mean, it's just like so wild that like any of this even happens.
Yeah,
it is wild.
Cool. I would love if you could define PMS as well from a physiologic standpoint, because I think that has also been like, oh, she's PMSing, or like, oh, she's crazy. But like, what's going on in your body to give us some grace? There are changes happening, and how maybe to take care of yourself.
PMS is premenstrual syndrome. And then we said earlier PMDD, which is like the more severe form of that. It is a conglomeration of physical and emotional symptoms that happen during the luteal phase. So a lot of women, once you kind of start hearing about this stuff, you're like, does the luteal phase suck? And it kind of does a little bit. So the luteal phase is when we are going through a drop off in progesterone. That decrease in progesterone is not super fun. So we can have some of the physical symptoms like fatigue, headaches, breast tenderness, nausea. And then we can also have some of the emotional effects of this. So some women feel sad, they're like crying at things they normally wouldn't cry about. They have a short temper, they're snapping at people they wouldn't normally, just feel really tired. And they're like, am I dying? Do I hate my boyfriend? Do I hate my husband? Or is it just that my period's due in a couple days? And this can be, sometimes this lasts for a couple days. Sometimes people are like, oh, the full 2 weeks from ovulation to the day I get my period, I am miserable. And then you get your period and you're like, I wasn't crazy. My period was just coming. And so that like the degree of severity sometimes is a driving factor for people doing systemic hormonal birth control of like, can we get rid of the luteal phase? Because it's awful.
But it's somewhat out of our control. Like it is related to a change of hormones. Our body's 100%. Response. Yeah. Okay.
You are not being rude on purpose. Like people feel they're like, am I crazy? They're gaslighting themselves. It's like, no, you're not crazy. You're just, your progesterone is falling off and that's not your fault.
But like every month I'll be like, I'm crazy. I'm so mean. Also, I'm so hungry. I'm insatiable.
Oh, yes.
Also, my skin is so bad and I smell. I'm like, what is... And then I'm like, oh, I'm just starting my period.
You're like, am I the most disgusting creature to walk the earth? Or is it just like, oh, my period's due?
Yeah, I know. It's so crazy. To wrap this up, Megan, do you have any helpful links or apps or anything that you like to recommend to women? I don't know, just to learn more about their bodies, to learn more about these cycles, birth control.
The website that I refer a lot of my patients to after I give them that really long spiel and then they like have this glazed over look and I'm like, think about it, is bedsider.org. So like bedside manner, bedsider.org. It has like a lot of just like women's health education resources. I love it. But if you specifically click on their contraception or birth control tab, it talks through all of the possible options of ways to prevent pregnancy. It talks about like the mechanism of action, so like how it works. It talks about side effects, pros, cons. You can put things side by side and compare them. So it's
awesome. Okay, that's a great resource.
There was another kind of question on here about natural family planning.
Yeah, talk about that.
I feel like more and more patients are kind of talking to me about this. I think that there's kind of more like maybe a little bit of a transition of people wanting to prioritize kind of like the natural approach. And sometimes that people are more comfortable with it. Like you said, Cruzy, it's like it's reassuring and it's empowering to see your period and know that your body is functioning in a healthy way. And you're like, could I use that to prevent pregnancy? So I like it. It is about 75 to 85% effective in preventing pregnancy. I know, right? I know. Which like, you know, and you compare it to an IUD, which is over 99%. But again, this is all about like, what are we prioritizing? I think for my patients who they're in a position where they're like, I don't want to get pregnant right now, but if I got pregnant, it would not be the end of the world.
Yeah.
Cool. Let's do natural family planning. If you have a reason where if you got pregnant, it would be the end of the world, maybe it's not our best option. And the reason for kind of like the lower efficacy compared to the other methods is because it relies on two things. One, it relies on your body being pretty darn perfectly regular. Yeah. And some people are, but you know, sometimes things happen. Sometimes you ovulate early or you ovulate late or you skip a period or you got sick. And so that shifts your cycle. And, you know, that's, you know, we can't always predict our body to be exactly perfectly regular. And the other thing is that like, it takes a lot of effort on your part. If you think taking a pill every day takes a lot of effort, you know, the components that are involved in natural family planning are like tracking your cycle and tracking basal body temperature and tracking your cervical mucus, using ovulator predictor kits to see when you're ovulating and using condoms when you're in your fertility window or just not having sex. And it requires so much effort on people's part. And so if people are down to do that, then I think it could be a good option. So I like the natural family planning method. And I kind of like the emphasis that people are putting on their natural cycle and how they can feel empowered. But I also do kind of encourage people, I feel like sometimes that emphasis on prioritizing natural things can sometimes come across as almost shaming women who
Yeah.
sometimes do use hormonal birth control. And people are like, how can you put all those hormones in your body? You have no idea what it's doing to you. And I think that's kind of what we're trying to do, is like maybe unpack some of those myths. But
Yeah.
also, there are so many reasons to be on different hormonal birth control, non-hormonal, what have you. Some women use it to prevent pregnancy. Some people use it to manage PCOS or manage endometriosis, or there's so many reasons women can be on it. And so I feel like being a woman is hard enough, and so we should just respect that people are, different things work best for different people, and if it's not a good fit for you, it doesn't mean it's not a good fit for somebody else. And so we should lift each other up and empower each other to do whatever works best for you, whether it's a birth control pill or tracking your period or doing a condom or whatever it is.
Yeah, I love that answer. That's really helpful. I think too, for me, what seemed to work with like my situation, my timeline of wanting to get pregnant, being comfortable with being pregnant during like a 6-month period was getting my IUD out about 6 months before I was actually like, I want to be pregnant today,
Yeah.
which I know you said wait, but for me, switching to natural family planning with the Natural Cycles app, checking my basal temperature every day,
Hmm.
abstaining or using a condom during the fertile window, pulling out, like all of those things during that period after getting the IUD out, to me was very reassuring and comforting to know my body was fully regulating in a way before I was ready to actually get pregnant. And I've heard that from a lot of friends where they're like, I just want a few months, ideally, off of birth control before I want to get pregnant. And so to me, that's where a lot of times natural family planning could be really helpful.
Mm.
Yeah, I feel like I do have a lot of patients who kind of make that transition, which I fully support. And we kind of go into it with the knowledge, I'm like, knowing that like, hey, we could maybe get pregnant during that time. And they're like, yeah, it's okay. It's not what we're going for, but like we would be okay if it happened.
Yeah.
And I think doing that, the transition from natural family planning to then trying to conceive is pretty seamless and awesome, because you like do
Yes.
exactly the opposite of what you were doing, right? The times when
Yes.
you were like, well, we cannot have sex or we have to use a condom. It's like, and now this is when we have sex. So like that
Yeah.
can be a really awesome transition. Yeah.
Yeah. That's great. Okay. One last question. You said
Yes.
if you get sick, it could alter your cycle. What do you
Mhm.
mean by that?
Yeah. The body is wild. And so there can be so many things that you could cause you to maybe not ovulate or maybe to delay ovulation. So like I had a couple months ago, oh my, I had what I suspect was giardia. Um,
Oh,
I know, right? We went whitewater rafting and I was screaming the whole time because
Ooh.
I was so scared. The people I was with my in-laws and they were cooler than me. They were not scared. They were like smiling, having fun. The pictures, everyone's like smiling and laughing, and I'm like,
and
You're like
water was just
Drinking
shooting
water.
into your
oh,
mouth.
I know. And so then 2 weeks later, I was like so GI bug
Wow.
type sick. It was so
Oh.
awful. But it's like something like that. Like I think that that can shift things. And so if your body gets a hint of like, should we not be pregnant right now? Are you not
Mm.
okay? It'll be like, you know what? Let's not ovulate right now.
That's so
So
cool.
sometimes people come to me because they've skipped a cycle. And I'm like, what happened last month? They're like, actually, my grandmother died and I was,
Mm.
I've been really torn up about that. Or they're like, I shifted my diet and I became vegetarian, or I started working out and I've lost like 12 pounds of body fat and I've built muscle. So it's like some of those shifts where your body's like, something changing, maybe this is not a good time to get pregnant.
Hmm.
And so you might not ovulate that month, or it might delay ovulation. So many things. Yeah.
That's fascinating. Okay. Eden, anything else before we close?
No, I
I
mean, I
feel like I'm
think we're
like,
gonna
before
have
we
to
pray.
I think we're gonna have to have you back because there is so much more to talk about. And even like I feel like I'm seeing a lot about how to like take care of yourself during the luteal phase. And I don't know if there's like again, what's a myth, what's true, but I feel like that could be an interesting one because um to like take control. Like if you need to have a slower week or if you need to just like have a minute, that's fine. But also we have a lot going on. So what are ways that we can support ourselves to be our best self even in those phases? So yeah, we might be calling you again.
I love it.
Hmm.
I love chatting with you guys. I
Again,
come back whenever you want.
you're like so perfect. You're
Stop
so
it.
good at explaining and so
Hmm.
bubbly, and you make women feel like empowered and happy about their bodies. So I can't thank you enough. Thank you so much.
You are
And
so kind to say that. My ego doesn't need it. Stop.
stop. Come on.
No, keep going.
No, but we definitely want to have you back. So thank you for being here.
Yeah, thank you
We
guys so much
appreciate
for
it.
inviting me. I was so excited to do this, so I love this.
As a reminder, the information shared in this podcast is for informational and educational purposes only. The information shared is generalized and therefore is not personalized to your unique needs. You should always seek care from your own provider directly for questions and concerns about your health.